Ever wondered if all those wound care methods you've heard about actually work? Let's dive into this fascinating world of wound care and debunk some common misconceptions. One of the most prevalent myths out there is that all antimicrobials can be mixed and used for wound care. It seems logical, right? More is always better? Well, not exactly. Wound care is not a one-size-fits-all approach, and not all antimicrobials play nicely together. Understanding the science behind wound care is crucial. It's not just about slapping on a bandage and hoping for the best. It's about knowing what's going on beneath the surface, understanding how different treatments interact, and making informed decisions to promote healing. This might come as a bit of a shock to some, but mixing antimicrobials without proper knowledge could do more harm than good. It's a bit like trying to bake a cake without following the recipe. The end result could be less than appetizing. To understand why mixing antimicrobials can be risky, we need to dive into the science behind wound care. A wound initiates a complex series of events in the body, starting from coagulation to stop bleeding, and moving on to inflammation to fight infection. This is followed by the proliferation phase, where new tissues are formed, and finally maturation, where the wound closes. Antimicrobials play a crucial role in this healing process. They act like soldiers in the battlefield of wound care, combating harmful bacteria that could potentially delay healing or even cause a wound infection. There are various types of antimicrobials, each with their own unique functions. For instance, iodine is often used for its broad-spectrum antimicrobial properties, while silver is known for its potent antibacterial effects. However, not all antimicrobials are compatible. Mixing them without professional guidance can be like putting two different armies on the same battlefield without a common strategy. They could end up fighting against each other rather than working together against the common enemy, infection. This can disrupt the healing process, causing the wound to take longer to heal, or worse, leading to complications such as increased inflammation or even antibiotic resistance. In essence, the science of wound care is a delicate balance of various factors. Antimicrobials are essential players in this process, but they need to be used judiciously and in the right combinations. So the indiscriminate mixing of antimicrobials can disrupt the healing process and may even lead to complications. Now that we understand the science, let's delve into the risks associated with mixing antimicrobials. When it comes to wound care, one must tread carefully. Mixing antimicrobials can spark a host of issues. Let's talk about allergic reactions first. Some people may have unexpected allergic responses to certain antimicrobial combinations, which can exacerbate the wound instead of healing it. Then there's the danger of antibiotic resistance. It's a global concern, you see. When antimicrobials are used haphazardly, bacteria can adapt and become resistant, making future treatments less effective. Lastly, there's the potential disruption of wound healing. Some antimicrobials, when mixed, can interfere with the body's natural healing processes. This can prolong the healing time and even lead to complications. Remember, professional guidance is essential when using antimicrobials for wound care. Every wound is different and requires a unique approach. As you can see, mixing antimicrobials isn't as straightforward as it might seem. In conclusion, it's essential to debunk the myth of indiscriminate mixing of antimicrobials in wound care. We've unraveled the science that underscores the importance of individualized wound care and shed light on the risks of mixing antimicrobials. It's clear that this practice can lead to complications and hinder the healing process. It's crucial to follow professional guidance and avoid self-treatment. Remember, when it comes to wound care, knowledge is power. Don't risk complications by mixing antimicrobials without professional guidance.